una vegada més, una càtedra més, una iniciativa més, un graó més d'aquesta escala tan poderosa i tan ferma que des que soc rector d'aquesta casa he tingut el goig de poder visitar i que des de fa molts anys que soc part d'aquesta universitat he pogut gaudir. De manera que moltes gràcies a tots vostès per acompanyar-nos aquest matí una vegada més en motiu d'un esdeveniment important associat a la nostra facultat com és la Càtedra de Malalties Autoimmunes GSK. Molt bé, doncs anem a donar pas al contingut de l'acte i en primer lloc és un plaer donar la paraula al doctor Ricard Cervera, director de la Càtedra Universitat de Barcelona GSK de Malalties Autoimmunes.
Bé, moltíssimes gràcies, il·lustríssim senyor rector, moltíssimes gràcies a totes les autoritats que ens acompanyen en aquesta taula i també, sobretot, a tots vostès per acompanyar-nos en aquest acte que ens fa tanta il·lusió poder fer. També una salutació especial a la gent que ens està seguint per streaming. Aquest matí hi havia gairebé 150 persones registrades i a banda hi ha una sala a Santiago, que s'està celebrant el Congrés de la Societat Espanyola de Medicina Interna i hi ha molts autoimmunòlegs allà i gent del nostre servei també ens estan seguint en directe. Per tant, salutacions cordials a tots ells, també saludos a muchos amigos y compañeros que nos siguen desde América. Sé que también, aunque son altas horas de la madrugada, nos están siguiendo. Doncs, abans de presentar la nostra càtedra en concret, potser unes pinzellades per a aquelles persones que no coneixen les càtedres i aules de la UB, que és una iniciativa de la Universitat de Barcelona per col·laborar entre la universitat i empreses i diverses entitats. I és una iniciativa d'èxit. Actualment hi ha 41 d'aquestes càtedres en funcionament i hem de dir que estem molt orgullosos des de la Facultat de Medicina i Ciències de la Salut, que són probablement la facultat que més càtedres ha creat, i en tenim càtedres dedicades a arrítmies, a oncologia, a medicina de precisió, medicina interna, a diferents aspectes, i un d'ells vam considerar que era també estratègic, eren les malalties autoimmunes. I per això vam decidir també engegar aquest projecte per dedicar-lo a les malalties autoimmunes que, com saben, és aquest enemic interior que tots tenim, que de vegades ens ataca i quan ens ataca no ens hi podem amagar. No és ja aquella situació que es deia a principis del segle passat, que va ser quan es va descriure aquestes malalties, que era l'horror autotòxicus, però continuen sent unes malalties molt complexes, difícils moltes vegades de diagnosticar, de controlar, amb medicaments difícils moltes vegades d'utilitzar. Amb un intent que vam tenir el doctor Gershwin, el doctor Schoenfield i jo mateix de sistematitzar aquestes malalties fa uns anys, vam agrupar-les en 103 patologies diferents, unes d'elles específiques d'òrgans i altres sistèmiques. Moltes d'elles són poc freqüents, però totes en conjunt ara sabem que poden arribar a afectar fins al 20% de la població general. Per tant, en conjunt és una patologia important i prevalent que mereix l'atenció. I aquest hospital, com en tantes altres ocasions, va ser pioner, ara fa gairebé 35 anys, en la creació d'un equip, una unitat i posteriorment un servei dedicat específicament i exclusivament a les malalties autoimmunes. I aquest equip ha fet moltes coses, ha arribat a ser centre de referència. Recentment, que tot això s'ha institucionalitzat molt, hem estat nomenats unitats d'expertesa clínica per el Departament de Salut de la Generalitat en malalties autoimmunes sistèmiques i autoinflamatòries, a nivell estatal, CSURS, en malalties autoimmunes i autoinflamatòries, i a nivell també europeu som membres de les xarxes de malalties minoritàries, Reconnect i RITA. Però el que m'agradaria potser remarcar més són les activitats més acadèmiques, activitats docents, activitats d'investigació que portem a terme aquest equip, activitats docents de grau, de postgrau, de formació de residents, de formació mèdica contínua. De grau a la universitat portem una assignatura troncal, de postgrau un màster oficial de malalties autoimmunes, participem en el programa de doctorat. Una de les joies de la corona és aquest màster oficial en malalties autoimmunes, que ja arribem a l'edició número 13 i que cada any 20 metges, generalment la meitat europeus, l'altra meitat d'Amèrica, es formen amb nosaltres i ja més de 200 metges s'han format amb malalties autoimmunes. Tesis doctorals dintre del programa de doctorat de Medicina i Recerca Translacional, més de 50 tesis doctorals s'han llegit, dirigides pel nostre equip, i també tenim un doctor honoris causa que després clarament serà el protagonista d'aquesta jornada. Formació de residents, ja som probablement un dels equips que tenim més rotants amb nosaltres, moltes generacions de rotants han passat per nosaltres, de tota Espanya, del món, i ara els agrupem en una xarxa d'alumni, creat la Barcelona Clinic Autoimmunity Alumni, on tenim més de 700 ex-fellows, ex-residents, que els intentem mantenir units a través de diferents activitats, com per exemple aquest bloc. I moltes activitats també de postgrau, molts cursos, entre ells, per exemple, el ja clàssic 10 Topics, que fem conjuntament amb l'equip del doctor Hughes de Londres, i molts altres cursos, el Simule, el FOGMA, la Lupus Academy, és una iniciativa global que vàrem crear ja fa 11 anys i que la vàrem crear des d'aquí de Barcelona, i cada any ens fem moltes activitats arreu del planeta. Preceptorships, llibres, aquestes són el llibre de butxaca de les malalties autoimmunes que es fa servir tant a tot l'estat espanyol com a Llatinoamèrica. És ja tot un clàssic, i molts llibres, per exemple, de la síndrome antifosfolipídica, que tant parlarem avui a la segona part amb el doctor Hughes, també hem editat des de nosaltres i en col·laboració amb altres grups, diverses monografies, i portem col·leccions de malalties autoimmunes. I activitats de recerca, l'altra gran activitat acadèmica, la portem a terme a través de dos grups de recerca, de l'IDIVAPS, el de malalties autoimmunes sistèmiques i el de vasculitis sistèmiques, que lidera la doctora Cid, però sobretot treballem amb grups, amb xarxes internacionals, moltes xarxes internacionals, i també estem molt contents que hem promogut probablement les pioneres, als anys 90, quan vam començar a treballar amb el doctor Hughes, vam crear el grup Eurolupus, que ha sigut un grup que després ha generat també molts altres grups, i també vam crear el grup dels anticossos antifosfolipídics, el European Forum on Antifosfolipídic Antibodies, que tants fruits ha donat en molts projectes, i tot això certament es manifesta en moltes publicacions. Només a tall d'exemple, aquestes són les publicacions que fem al nostre grup. L'últim any, l'any passat, vam publicar gairebé, o surt un equivalent a un article original per setmana. I això ha fet que, ara que tot es mesura, es computa, hi ha índexs de tot per indexar, dintre de la nostra àrea de coneixement, que seria reumatologia i malalties autoimmunes, entre el top 10 dels investigadors, 4 són membres del nostre equip. I això volem que s'incrementi, que es complementi, que generi encara més sinergies i potenciacions amb aquesta càtedra que acabem de crear, la càtedra UB-GSK de malalties autoimmunes. Té com a objectiu fonamental encara fomentar més la docència, la recerca i la difusió dels coneixements en aquest camp. I per això, a banda de les coses que he comentat, intentarem fer algunes coses més, i ja tenim aprovades, i hem començat a fer coses com fomentar la docència en aquestes malalties amb 20 beques per a estudiants per realitzar el màster en malalties autoimmunes, en premis a la recerca, un premi i 2 accèssits als millors treballs finals del màster, en jornades científiques, fa uns dies vàrem fer l'Autoimmunity Day, i avui crearem la Autoimmunity Oration, que esperem que sigui una conferència magistral anual on puguem convidar persones de gran relleu internacional en el camp de les malalties autoimmunes. I tot això ho farem amb aquest magnífic equip que realment estic immensament orgullós de tenir, que pugui formar part d'aquesta càtedra, alguns dels quals estan aquí en persona, altres estan connectats, el doctor Espinosa, el doctor Hernández, el doctor Ramos, la doctora Cid, la doctora Espígol, el doctor Ríos, la doctora Lledó, la doctora Araujo. Els sèniors són líders mundials en les seves àrees de coneixement dintre les malalties autoimmunes sistèmiques. Els més joves ho seran segur que ben aviat. I això és el que pretenem fer des de la càtedra. Moltíssimes gràcies per l'atenció.
Moltes gràcies, doctor Cervera. I passem la paraula al senyor Ricardo Boedo Facal, director regional de Government Affairs de GSK.
Buenos días a todos. Buenos días. Bueno, en primer lugar, saludarles a todos. Buenos días. Gracias por estar aquí. Gracias a todas las personas que nos siguen por streaming, que la verdad que es todo un éxito con esa diferencia horaria que en otros países de otro uso nos sigan. Autoridades, señor rector, señor director general, señor director médico, doctor Cervera, todos los presentes, gracias. Lo primero que me gustaría desde GSK es dar las gracias al doctor Cervera y a toda la academia por contar con nosotros. Tiene todo su sentido que estemos aquí. Voy a hablar en unos minutos qué es lo que hacemos para avanzar, al igual que ustedes, para mejorar la salud de las personas. Somos una compañía biofarmacéutica y estamos guiados fundamentalmente por la ciencia y por la innovación responsable. Tenemos un propósito que es ayudar a las personas a vivir más, con mejor calidad de vida y durante más tiempo. Investigamos, desarrollamos y producimos tanto fármacos innovadores como vacunas. Nos cuesta mucho esfuerzo y mucho trabajo, al igual que ustedes, ir avanzando. Las innovaciones son pequeñas mejoras que vamos incorporando día a día y en sitios como la Facultad de Medicina y Ciencia de la Salud, como hacéis aquí, como hacen ustedes, vamos avanzando. Nos acordamos todos de las 8 o 9 modelos de vacunas que estamos utilizando estos días, pero nadie se acuerda de los 290 moldes que se nos han ido cayendo y de otros 200 o 300 que seguirán cayendo en los próximos años. Pero aún así hay que seguir trabajando porque ese es el camino de la innovación y de la investigación. Nuestro enfoque de investigación y desarrollo se centra en la ciencia relacionada con el sistema inmune y con el uso de medicamentos transformadores, priorizando aquellas moléculas con mayor probabilidad de éxito, sobre todo para dar soluciones rápidas a situaciones de emergencia como la que tenemos hoy. Estamos impulsados por ese efecto multiplicador que nosotros denominamos ciencia, tecnología y cultura, y este efecto nos ayuda a acelerar el ritmo en que desarrollamos y proporcionamos a la sociedad medicamentos transformadores, priorizando aquellas moléculas, como he dicho, más eficaces. Esta colaboración junto con la Cátedra de Inmunología busca fomentar la docencia, investigación y difusión del conocimiento. Hablábamos de las enfermedades raras anoche, hablamos de las enfermedades autoinmunes. Casi 800.000 catalanes sufren una enfermedad autoinmune, pero siguen siendo desconocidas. Yo creo que el gran papel de cátedras, de iniciativas de este tipo, por eso les doy las gracias en nombre de GSK, buscan ese conocimiento, esa difusión, mejorar ese infradiagnóstico también. Por ejemplo, el lupus eritomatoso se confunden mucho los síntomas con otras patologías. Tenemos que trabajar para que estas personas puedan tener acceso a ese diagnóstico, a esos tratamientos eficaces. Yo, para terminar, una vez más, gracias a todos ustedes que están aquí, que hacen posible que sigamos avanzando. Nuestro compromiso es claro con la educación de calidad, ¿de acuerdo? Y esta cátedra es un ejemplo de ello. Muchas gracias.
Muchas gracias, muy amable. I passem ara la paraula al doctor Antoni Castells, el director mèdic de l'hospital.
Bon dia, moltes gràcies. Gràcies, rector magnífic, autoritats, companys, amics. Per mi és un plaer estar avui aquí i vull començar agraint-li al doctor Cervera que m'hagi convidat a participar-hi. En segon lloc, vull agrair també de manera molt especial a la Universitat de Barcelona i a GSK l'esforç per tirar endavant aquesta càtedra que crec que reforça de manera molt significativa l'activitat que ve fent el Servei de Malalties Autoimmunes, com el doctor Cervera ha demostrat molt clarament amb la seva presentació. Jo les meves paraules, que seran molt breus abans que agafem tots aquí un refredat amb la ventilació d'aquesta sala, van dirigides bàsicament a posar en valor el Servei de Malalties Autoimmunes, un servei que ja en el seu moment fa 30 o 35 anys que es va posar en marxa en aquell moment malauradament pel doctor Josep Font i posteriorment seguit pel doctor Ricard Cervera, va ser una aposta completament innovadora, que tenia un cert risc en aquell moment i jo diria única en aquell moment i crec que encara continua sent bastant única en el nostre entorn. Per tant, aquest grup de gent que avui els tenim aquí representats han sigut pioners de començar una nova atenció al malalt, oblidant una mica la manera que tenim organitzats els hospitals, que són encara molt hospitals depenent d'especialitats mèdiques. Aquí és un servei que no pivota sobre una especialitat pròpia, poder algun dia ho acabarà sent, per tant, aquest és un aspecte important. Dos, sempre ha tingut una atenció molt centrada en el pacient, ara ho estem dient contínuament, però ells ja varen posar des del primer moment el focus en el pacient amb unes malalties complexes, moltes vegades. I tres, i avui és un bon exemple, amb una aproximació molt multidisciplinar, no treballant només el grup de gent, sinó aquí podem veure gent de nefrologia, gent d'oftalmologia, gent d'infeccions, gent de medicina, gent de reumatologia, que és la manera que hem de treballar als hospitals. Cada cop anem trencant les barreres dels serveis, anem a unitats multidisciplinars, probablement d'aquí uns anys els hospitals s'organitzaran d'aquesta manera i, per tant, de nou, aquest servei ha sigut completament pioner. Han fet les tasques que ens correspon fer en els metges d'hospitals grans com els nostres, fer assistència, fer recerca, fer docència i fer-la ben feta. El rector, probablement a partir d'ara, rebrà cada Nadal, com rebo jo, una memòria de l'activitat que fan i he de dir que cada any que ho rebo quedo més impressionat i gairebé em faig creus que puguin fer tantes coses, així que rector, vés-te preparant que el rebràs aviat. Res més, també dir que la gent, i el doctor Cervera és un bon exemple, el doctor Font també, que en tinc un molt record d'ell, han sigut exemples de la importància del professionalisme en la medicina del segle XX i del segle XXI, el doctor Cervera. Jo crec que el professionalisme és completament vertebrador del que és la medicina, tant en l'àmbit acadèmic com en l'àmbit hospitalari, i reforça aquests valors que crec que tots hem de tenir i que aquesta unitat o aquest servei clarament ho representa, de responsabilitat, de compromís, de generositat, de gratitud, de confiança en el sector sanitari i, per tant, jo crec que avui els hem d'agrair tota la feina feta en aquesta direcció i desitjar-los el millor en aquesta càtedra que avui comencem. Moltes gràcies.
Moltes gràcies, doctor Castells, i gràcies per l'advertiment, i així em prenc bona nota. En tot cas, anem a la part final ja d'aquest acte. Doctor Campistol, si és tan amable.
Bé, moltíssimes gràcies, magnífic rector, bon dia a tothom, doctor Cervera, doctor Hughes, amics i companys. Amb la línia que deia el doctor Castells, tenim aquí el doctor Trilla, el màxim expert d'epidemiologia del Covid en el nostre país. Estic convençut que no hi ha ni una gota realment de Covid circulant per als aerosols, però que no sé si hi haurà algun altre virus circulant. Sort que tenim els magnífics polars de l'hospital que ens abriguen i ens permeten, perquè si no crec que sortiríem tots d'aquí amb un refredat, però realment crec que la ventilació, doctor Trilla, està absolutament garantida. Bromes a part, jo també seré molt breu, bàsicament tres missatges. Hem sentit en el doctor Cervera la seva apabullant xerrada, ho deia abans també el doctor Castells, la memòria que rebem cada any del doctor Cervera i del Servei de Malalties Sistèmiques d'aquest hospital és autènticament impressionant. I avui veiem aquesta aula magna de la facultat pràcticament plena de gom a gom, amb molts companys de l'hospital, de totes les especialitats, i aquest és, d'alguna manera, el doctor Cervera i el Servei de Malalties Sistèmiques d'aquest hospital, que també vull tenir unes paraules de record per al malaurat doctor Josep Font, que va ser el creador d'aquest servei. Realment veure aquí nefròlegs, veure aquí hematòlegs, veure aquí neuròlegs, veure aquí reumatòlegs, veure aquí tot l'hospital o totes les especialitats representades és una mica la manifestació del valor que ha tingut realment aquest servei de malalties sistèmiques creat en el seu moment per al doctor Font i que ara ha dat d'alguna manera amb el màxim nivell el doctor Cervera. Per tant, crec que avui és un dia de reconeixement d'aquest servei, de reconeixement de la tasca feta de l'equip del Servei de Malalties Sistèmiques i del reconeixement de la feina de tot l'hospital. Per tant, doctor Ricard Cervera, Ricard, moltíssimes gràcies i enhorabona realment per tota la feina, per aquesta empenta, per aquesta energia, per aquesta determinació en fer les coses ben fetes i d'alguna manera aquest hospital crec que és el que és, igual que aquesta universitat, gràcies a professionals com tu. Per tant, moltíssimes gràcies. El segon és simplement manifestar realment el compromís de l'hospital amb aquest model. Tenim molt sovint el rector aquí, el qual realment és un orgull i és un gust per tots nosaltres i tal com deia el Ricard, en el darrer any o any i mig hem inaugurat i hem obert moltes càtedres temàtiques en el marc de la universitat en col·laboració amb l'hospital. Crec que és un bon instrument que s'ha desenvolupat en el marc de la universitat, en el marc de la facultat, que s'ha impulsat des del decanat, el doctor Trilla, el doctor Nicolàs, el doctor Cervera, i crec que és un bon element realment per gestionar, per vehiculitzar elements d'interacció entre la part assistencial i la part docent i també la part de recerca que són essencials. Per tant, de nou, el compromís absolut de l'Hospital Clínic amb les càtedres temàtiques, amb totes les que hem muntat i segur les que vindran en un futur immediat, i crec, com dic, que és un bon instrument una mica per arribar a la part docent i sobretot per integrar un element clau que és l'assistència, la docència i la recerca que d'alguna manera tots hem après que és un cercle virtuós que cal nutrir, que cal potenciar, però que té un valor important. I més avui que crec que de manera molt important i molt significativa l'hospital, la facultat i la universitat anem de la mà i crec que això és important. Molts de nosaltres som metges, molts de nosaltres som professors de la universitat amb diferents categories i tots veiem realment que aquesta simbiosi hospital-universitat és tremendament important per nosaltres, però jo diria per al sector sanitari, per al sistema sanitari del nostre país, igual per al sistema docent del nostre país. Per tant, benvinguda realment aquestes càtedres docents, benvinguda aquest treball amb equip i aquesta unitat entre l'hospital i la universitat, i en aquest cas la Facultat de Medicina, i tingueu la certesa que des de l'hospital li donarem tota la força i que tingueu tot el compromís. I no volia acabar sense agrair realment a la gent de GSK, aquesta indústria que sempre ens ajuda, ens ha ajudat molt amb les vacunes, i ho explicava abans el senyor Boedo, però que ens està ajudant en moltes coses i que d'alguna manera el seu recolzament, la seva ajuda econòmica ajuda en el manteniment d'aquestes càtedres. Per tant, per part de l'Hospital Clínic, a la gent de GSK, moltíssimes gràcies per la col·laboració, gràcies per estar aquí. Ricard, moltíssimes gràcies per la teva feina, per la teva empenta i molts èxits d'aquesta càtedra. Moltíssimes gràcies.
Moltes gràcies, doctor Campistol, i finalment, estimat, benvolgut, admirat, senyor Degà, quan vulgui.
Buenos días, bon dia. Si això fos el Parlament diria por alusiones. Dos coses. La temperatura exterior és d'11 graus. Per tant, la temperatura interna deu ser d'uns 10 o 11 graus aproximadament. Està plovent, el qual és una bona cosa, perquè quan la humitat relativa és molt alta el virus té més dificultat a transmetre's, per tant va bé. I hem fet una valoració de risc i hem decidit que era millor agafar un refredat que la Covid. Per tant, diguéssim, ho sento, és el que hi ha. Vista la situació i les crítiques justificades al fred que fa la sala, quan acabem aquests parlaments tancarem la meitat de la finestra, i així la cosa millorarà. Dit això, dues coses molt ràpides, perquè no crec que subscriveixo totalment tot el que s'ha dit, tots hem viscut aquesta història. De fet, quan el doctor Cervera ha dit que es va crear el servei fa 35 anys, jo crec que són una mica menys, perquè nosaltres, o almenys jo, ja estàvem allà. És com el conte del dinosauri. Dius, ostres, tu, ja hi érem per allà, no? Però la veritat sigui dita és que l'equip de malalties, més que el servei, com s'ha dit, és un equip. Evidentment, és obligat recordar el doctor Josep Font i després tots els que han seguit la seva estela, el doctor Cervera, el doctor Ramos, el doctor Espinosa, molts estan aquí, més tots els altres companys de l'hospital. També vull donar welcome, Professor Hughes. It's an honor for us that you are Doctor Honoris Causa of this university, though this is your home. It's not London Bridge Hospital, but it's quite pretty much the same for us. So welcome here to the school. Dit això, molt ràpidament, potser 3 coses importants que s'han dit perquè jo crec que val la pena ressaltar. És la gran, si em permeteu, és una reflexió una mica així, el formalisme i el fet de fer les coses des del punt de vista ben fet que té tot l'equip de malalties autoimmunes sistèmiques. És gent seriosa, que sempre es fa les coses molt bé, que mantenen les formes acadèmiques, que, com s'ha dit, fan unes memòries impressionants, que dius, ostres, tu, molt curoses. Jo crec que és, si em permeteu, l'únic equip de l'hospital que guarda totes les dades. Els altres no sabem ni on les tenim, però ells les tenen totes i ordenades i saben totes aquestes coses, el que han fet, etc. I, sobretot, aquesta vocació docent, que per la universitat i per la facultat és molt important, òbviament també per la formació dels professionals, s'han dedicat i es dediquen amb cos i ànima a ensenyar, a explicar tot allò que saben, tot allò que creuen, tot allò que creuen que és d'interès per a la resta de professionals, i aquesta vocació docent la tenen clarament amb una vocació oberta, internacional, en molts indrets del món, tenen col·laboracions, venen alumnes, venen metges, etc. I, finalment, jo simplement també agrair, com no pot ser d'una altra manera, a GSK, que és una companyia amb la qual ens dediquem a les vacunes i confiem plenament, de manera que ja la tenim molt, molt, molt coneguda, i desitjar que aquesta càtedra realment l'únic que faci és afegir encara potser la cirereta, el pastís d'una feina molt important que ja es fa per moltes persones que estan aquí a la sala, i personalitzarem els agraïments al doctor Cervera, que tenim la sort de comptar amb ell dintre de l'equip de Ganal, i per tant per nosaltres és un doble honor. Moltes gràcies, i els hi prometo que quan acabem això tancaré la meitat de la finestra.
Moltes gràcies i res, 30 segons per tancar aquest acte. Doctor Cervera, senyor Boedo, doctor Castells, estimat director, estimat degà. És un plaer estar aquí. De veritat és que ja són moltes vegades i, per tant, en els darrers mesos en els que tinc el privilegi de dirigir la Universitat de Barcelona són ja moltes vegades les que he estat a la Facultat de Medicina i, per tant, estic encantat una vegada més de poder-ho dir. I només 2 o 3 reflexions, perquè efectivament, estimat degà, la temperatura és la que és. L'afirmació del doctor Campistol de gràcies als polars del clínic, qui els té?
Però ja has de regalar un.
Jo em limito a assenyalar dades, que és el meu ofici, i en conseqüència afirmacions genèriques en ciència s'han de matisar, però és un goig veure primer la sala com està, segona el motiu. Aquesta càtedra té diverses lectures, jo només en faré 2 o 3 molt breus, insisteixo, perquè quedi clar la nostra posició. Si alguna cosa en els propers anys s'ha de veure incrementada o s'ha de veure potenciada o s'ha de veure encara més posat en relleu, és la necessitat que conceptes com medicina personalitzada, parlem de malalts, no de malalties, parlem d'avenços amb la bionanotecnologia associada al tractament terapèutic, aquest concepte tan maco i tan interessant pels psicòlegs, ja que el doctor Campistol es deixa de citar els psicòlegs de la sala, doncs és important, és aquesta idea de perfilar la intervenció de la forma menys traumàtica possible i més perfilada possible. Clar, això és especialment rellevant quan tens l'enemic a casa. I, en conseqüència, tot aquest concepte al voltant del desenvolupament que dissortadament la pandèmia ha posat en primera línia de l'activitat científica i assistencial, doncs, òbviament, és una, no diré excusa, però sí és un argument magnífic per recordar a tothom que si alguna cosa cal és donar passes accelerades en aquest sentit. I, per tant, res més oportú que avui donar pas no a una nova etapa en la que definim un nou escenari, sinó a potenciar encara un escenari tan potent i tan robust que el que es mereix és absoluta confiança. De manera que res més important per la Universitat de Barcelona que constatar la necessitat de seguir treballant en aquesta línia. Diuen que els trios són experiències que poden deixar conseqüències negatives. Però la meva experiència, no s'espantin, és que avui el que fem és reproduir un mecanisme de generar tríades que són extraordinàriament solvents. Perquè hi ha el binomi hospital clínic, anem a dir-ho així, més Universitat de Barcelona, ja és un binomi extraordinari, els hi puc assegurar. Però si en aquest binomi hi assumim i afegim la potència d'una entitat com GSK, tenim el triangle perfecte per definir la millor manera de fer front als reptes que la humanitat ha de resoldre en els propers mesos. No perquè passem de la Covid als refredats amb recidiva, sinó perquè, efectivament, aquesta és una història que ha catapultat tot aquest quadre clínic d'una forma que mai haguéssim pogut pensar. De manera que la oportunidad es extraordinariamente importante. Por lo tanto, muchas gracias por lo que implica de confianza en la institución puntera en el ámbito asistencial hospitalario de nuestro país y de largo en Europa. Gracias por confiar en esa estructura de conocimiento y de ciencia que nos va a hacer a todos más poderosos y más potentes y, por tanto, reiterar nuestro compromiso con esta institución, con este hospital, que es puntero y, además, de referència inevitable. Agrair, per descomptat, a tots vostès que aquest matí ens hagin acompanyat. Insisteixo, és un plaer estar aquí i més amb aquest motiu. Thank you, Dr. Hughes, to accept to be part of this activity. Thanks also for your oration, and it's a pleasure for us to have the possibility that your knowledge and role in the science is part of our university. It's a pleasure for us. I poca cosa més, estimat degà. M'he passat 30 anys explicant tècniques epidemiològiques i aquest senyor en un any i mig ha aconseguit que tothom entengui què és la incidència i la incidència acumulada, cosa que jo no he aconseguit explicant aquests dos conceptes durant 30 anys amb tècniques epidemiològiques. Però això demostra, per finalitzar, que la urgència clínica està per davant de moltes altres coses. I mentre no oblidem aquest detall, nosaltres que tenim la responsabilitat de fer-ho, anirem bé. Gràcies, m'alegra molt que hi hagi molta gent jove sentada a la sala, és un gran indicador de la potència de la institució i del futur. Gràcies al vicerectorat, a la gent de les càtedres, perquè cada vegada que anem això hem de recordar que és un catalitzador magnífic perquè això sigui una autèntica realitat. Doctor Cervera, és una meravella, espero rebre la memòria i no pateixi, que quantes més en rebi, molt millor per tots, i si són més gruixudes, molt millor per tots, perquè indica potència i robustesa. Doctor Compistol, com sempre, un plaer, degà, doctor Castells, i a tots vostès, moltes gràcies, i passem ara al que importa, que és escoltar la gent cansada. Gràcies.
Thank you very much. Moltíssimes gràcies, senyor rector. It is really a pleasure to be here at this moment to continue this academic event. It is the first time that we organize this event, and we hope that we will continue doing this every year. It is the Autoimmunity Oration. We want, with this oration, to honor persons that have contributed to autoimmune diseases on the top. And it is really an honor that this very first Autoimmunity Oration will be delivered by Professor Graham Hughes. Professor Graham Hughes is currently the head of the Lupus London unit in London, but he is probably mainly known because the syndrome that has his name, the antiphospholipid syndrome. The antiphospholipid syndrome that was described by Dr. Hughes in 1983. I think in another famous oration of the Royal College of Physicians, the Prosser-White oration, where he put together several manifestations that we, and many people certainly knew before, but he managed to put all together, consider that this was a syndrome. The collection of thrombosis, fetal losses, abortions, cerebral disease, and the lupus anticoagulant that later was considered one of the now called antiphospholipid antibodies. He managed to put all these together. Later, this was called antiphospholipid syndrome, and also we want to honor, and many people honor this contribution, calling this also the Hughes syndrome. But in addition to this, a really very important fact, he has been probably the mentor, the teacher of many fellows from all over the world when he was working at the lupus unit at St. Thomas's Hospital, this famous hospital that is just in front of the Big Ben of the Houses of the Parliament, on the other side of the Thames River, that now has been very famous because the Prime Minister, when had COVID, was hospitalized there, and all over the world was known, this hospital. But this had the first unit devoted specifically to autoimmune diseases. He called just lupus, but it was for all autoimmune diseases. So was in some way the model that we have followed in our hospital. At this time, I put this picture in 1989, I was there, I was with him, and I am really very happy that we were at the time a group of very young people that now we are older, but many of them are now really very famous, worldwide known experts on autoimmune diseases, like Dr. Frederick Hughes or Dr. David De Cruz, the late Ron Asherson or Munder Hamashta, for instance. All of them nowadays are very famous experts on the field of autoimmune diseases. So his contribution to increase the knowledge of autoimmune diseases also is thanks to this fellowship work. And one of the things that we are more proud is the connection that we have continued with his team. And we have done many things together, but probably the most famous is the 10 topics in autoimmune diseases and rheumatology. Is probably the most important postgraduate course on autoimmune diseases that is delivered in this country. We have done this every year, and next year we will celebrate the 24th edition. Every year we continue doing this meeting with a close collaboration with Dr. Hughes' team. And very important, we have already mentioned, and being at the University of Barcelona, this is something that we have to remark. Professor Graham Hughes was honored as Doctor Honoris Causa of this university in 2004. This is a great recognition. There are very few doctors proposed by the Faculty of Medicine and Health Sciences that have received this great honor, the greatest honor of the University of Barcelona, and we are very proud that one of these is so closely connected with us is Professor Graham Hughes. These are some pictures just to remember that day with, you see the late Joseph Fon and Dr. Teresa Strack, that was the Dean of the Faculty of Medicine at that time, and with the Rector, Rector Tugores, receiving this prize. And also here together with Dr. Munder Hamashta, that has so many close relations with us. So this was a great day, and I hope that this will be also today another great day. because of this autoimmunity oration. It's a pleasure, Professor Hughes, to invite you to the podium to deliver the talk, The Antiphospholipid Hughes Syndrome, 40 Years and Counting. Professor Hughes.
Thank you very much, and thank you all for coming. I'm sorry, as many of you know, I can speak two languages, English and Welsh, but I don't think Welsh is any use to anybody outside Wales, except for the rugby, which is very important. So this is a short historical talk over the last 40 years. I'd like to start by just showing two very recent studies published in Lupus earlier this year, and I'll go back over them quickly. The first one concerns stroke, and this is a group whose Naranjo is the first author, and they looked at antiphospholipid antibodies in ischemic stroke, 245 patients, 28% positive antiphospholipid antibodies. And look at the bottom. Interestingly, in their fishing trip, was IgA anti-beta-2 was commoner associated than abnormal lipids in these patients with strokes. So it's just a feeling that this disease has an impact in a bigger way than even we expected. And the second one is very similar. This is from Jill Schofield in America, looking at migraine, a trial of antithrombotic therapy in patients with refractory migraine. And they found a dramatic improvement. I haven't put any figures up here, but it, again, for me, supports something that is very dear to my heart, something that is, I think, very true and yet not definite yet. So I'll start in the 40 years by going back to 1965 to 69. And my training was at the London Hospital, which may have similarities to here. This was a very, very traditional hospital in the East End of London, in the poor area of London. A lot of immigration there, a lot of very ill people, but a lot of interest. The Elephant Man was there in the museum. And Jack the Ripper, one of the spleens from one of his patients, is there. So it has these bizarre historical facts. But as a medical school, we loved it because it was probably the busiest medical school in the country. It was also historical that the London Hospital had a thing called the Lupus lamp. And this brought patients from all over the world to have this lupus lamp. Well, we now know it was nothing to do with lupus. A lot of these patients had skin rashes, including tuberculosis and so on. So the word lupus has merged really internationally into systemic lupus. This was my boss in the London Hospital, Michael Mason, a great teacher, extrovert, and he and Michael Curry published a book called Introduction to Clinical Rheumatology. And typical of the time, he pointed the finger at each of us and said, and my turn came, it was Hughes, write a chapter on lupus. Of course, I knew nothing about lupus except one or two patients. But he started my interest. But the fact was, I wanted to be a cardiologist, and that was my dream. And it shows all the teaching we give now about career advice and so on. And let me tell you how it happened with me. I went for an interview with my best suit and tie at the Brompton Hospital, where there was a cardiology job. And it went very well. And at the end, they looked at each other and said, well, Hughes, we'd like to offer you the job. And then there was big embarrassment because I said, oh, Dr. Jones's job. Oh, no, we got the wrong job. So I was being interviewed for a different post altogether, and it was very embarrassing. They all went away and said, come back in 6 months' time and you have a good chance. So I went back to the London Hospital, and my boss, Michael Mason, said, look, I've just seen in BMJ a job, a scholarship, 1 year in a place of your choice. And my wife and I, and our daughter, 3 years old, went to New York, which was many ways the happiest years of our lives. I worked for Charles Christian, who sadly died this year. Now, Chuck Christian was a fabulous guy, a very handsome man, loved by everyone, especially the nurses. As junior fellows, we used to go and get blood on the ward, and the American nurses, quite aggressive, used to say, "What do you want?" And I said, some blood sample, please. And they'd say, "Who's it for?" And I'd say, "Dr. Christian." "Oh, Dr. Christian." And then it was wonderful. And this was exciting times because my wife and I had a small apartment across the river in North New Jersey. And we were there while they were building the Twin Towers. It's very interesting, back in '69. But it was very exciting. Many of you have the feel for this when you go to a lab where things are really happening. And there were a lot of things happening in the lab. 1970 was the introduction of the FAR test. And this was a very simple test, radioactive iodine test. And this picture is one of my Octoloni plates, showing 2 serums with precipitin lines against DNA. Very, very nice, but not useful for mass production. So we got involved with a new assay, the FAR technique. And these were exciting days. You'd set the test up in the morning, adding radioactive and looking at DNA binding. And at 5 o'clock, you'd come back. And it was like my parents used to look at the football results at 5 o'clock. Very exciting, waiting for the results. And this is how it was here. It's hard to believe this, but the results came out like this. High DNA binding in the lupus patients, low in the non-lupus. And it really excited me and many others. DNA was not the only serology, and this cartoon gives you a background to some of the serologic things that we know about. The earliest, as you all know, is the Wassermann reaction. Then in 1948 came the LE cell, and ANA, DNA, ENA, and finally antiphospholipid, which is really the title of my talk. One of my old colleagues, very nice man, said to me one day, is ENA the next thing after DNA and ANA? And he showed his knowledge. This man is a great man. He is Mo Reiklin, and all the work on ENA, anti-Rho, anti-SM, and so on, stems from 2 people in particular, Eng Tan in California and Mo Reiklin and his wife in Midwest. In 1971 was my next move and got a job. And this was in the Hammersmith Hospital. Now that hospital was unique in the UK. It was had American attitudes. Research was very important, and the publications and the professorships were many from there. And I liked it because it had this atmosphere. It was not a bad thing to be very busy. And I stayed there for 5 years. This was the team. Some of you may recognize those people, which I'll show in a minute. But these were the team. And one of the things that we worked on particularly was the brain. Our main interest was lupus cerebritis, or brain lupus. And we were looking at one group of antibodies, lymphocyte antibodies, which were fashionable at the time. We were looking at them in lupus. And what we found that they overlapped or reacted, we thought, with brain phospholipids. And we were probably wrong, but we thought this had significance in terms of aspects of cerebral lupus. There were a number of case reports, but one of the papers that interested us was by Joan Rausch, I think was in Toronto. And she pointed out the similarities between DNA molecule and the phospholipid background. And that encouraged us because we thought there might be a relevance here. And at about that time from Hammersmith, I was asked to go to Jamaica to suffer badly at the beach in the sun, but it was a university hospital in big trouble, not enough doctors, chaos, and so on. And my job was to set up a lupus and rheumatology clinic. Lupus was common in Jamaica, common, and the poor people that affected it, and the figures of nephritis were higher than the then figures available. But what we did notice, a colleague of mine was paid for, a technician and myself, and we set up there for 1 year and had a number of interesting papers, but one was about Jamaican neuropathy. Now, I knew nothing about this, but this was young women ending up in wheelchairs with a transverse myelopathy. And they had, interestingly, a false positive VDRL, which in Jamaica was a big problem because positive VDRLs were also common. And we wondered whether in these women who had transverse myelopathy, that there was antibody reaction against VDRL, cross-reactivity with neuronal phospholipids. So our work, when we came back, looked at lupus. We set up a lupus clinic in Hammersmith. We were busy. We wrote books. We wrote papers. Systemic lupus, treatment and prognosis. And what interested me was not the classical lupus, the butterfly rash, but I listed these alternative criteria because the American College of Rheumatology, or ARA, criteria, for me, were too claustrophobic, too close. You'd miss out atypical cases, which includes the antiphospholipid syndrome. And some of these were childhood migraine, growing pains. Prolonged glandular fever was a common label in our patients. Agoraphobia. Phobias were common in the presumably neuropsychiatric aspect of early lupus. Septrin allergy, I want to point out, it's not used anymore very much, and it was a disastrous drug in lupus patients. Big exacerbations of disease. My secretary, who has lupus, was given Septrin back in those 30 years ago and had nephritis, has had to have a transplant. And this was exacerbated by Septrin. Chronic fatigue, of course, intermittent alopecia, of course, and here's one that may be wrong or may be right, that lupus patients don't catch colds. I don't know if you ask your patients this. We see so many come up with, yes, everyone in my family had a cold this year, but not me. And something that nobody's really, I know, has not investigated in a big way. If it's true, it's a lesson we're learning. We also wrote papers on treatment, and I was very keen on the idea of a more conservative treatment for lupus, to assess the outcome of a more conservative approach to treatment using, where possible, low doses of prednisone. We had the same look at cyclophosphamide, which was then the #1 favorite for severe lupus nephritis. And we felt that the ACR regime was too strong. So many young women with failure of the ovaries. And our St. Thomas's regime was 500 milligrams IV, hydration, and bladder protection. Just little changes, but more conservative. And two of our fellows, and that includes, I think, Rickard Evans, in the years to follow this, made this into the Euro-lupus regime, which was really became quite widely used until the era of biologics. In 1977, I published my book, The Connective Tissue Diseases. I don't know if any of you know this, but it was translated into Spanish. And I love this book. I love doing it because I had a Cardex card for every single reference. I was not a computer kid. And it was a work of hard work. But watch this next slide, because in that first edition, there is, I go backwards, this statement. And it's still there if you want to go back to see it. Exacerbations of lupus may occur at any time during pregnancy, though the immediate post-mortem period is critical. Now, nobody saw this. It came out in the book. It's there for you to read and make fun of me. The last few years have brought out this little cliche, lupus, the new epidemic. And the figures papers coming to the journal Lupus and so on, from China with 3,000 patients, on Korea, 5,000 patients, everywhere producing big numbers in lupus. Why? Why is there what appears to be a lupus epidemic and numbers going on? Well, it's possibly related to the increase we're seeing in all autoimmune diseases. This is an American figure of a couple of years ago from the NIH, where they had a figure of 23.5 million patients with autoimmune disease. And the American autoimmunization, as you expect, would have more. This is now a worldwide disease, apart from sub-Saharan Africa. Why is the increase? Well, there are many reasons, and I'm not going to go into them, except for two examples. Is it any change in the environment? Any change in genetics? We don't think so. Any change in the environment? This is one paper from Brazil, Natal city. It's called Sun City, I understand. Up to 288 hours of sun a month and a high incidence of lupus, which may be related or may not be. Education. This has changed. This was the old textbook that I used secondhand. It's called Davidson. And so I put it out of the bookshelf recently, and lupus got 5 lines in that textbook. Steroid dosage was 40 to 60 milligrams a day. It's so changed. Last year, this is Liverpool, and the patient societies from many countries, Europe countries particularly, came to that meeting in Liverpool, including a group from Spain. So patient associations have increased, I think, knowledge and numbers of lupus. But maybe one of the biggest influences is the media. And I think as new doctors, we all have to be media savvy now. But this is Lady Gaga and Selena Gomez, and both have lupus, and they have, one of them has been to our hospital, but they're open and public about the fact that they have lupus. And I publish here a letter which came to lupus from a doctor looking at Google Trends for what is lupus. And there are 3 peaks there. These are the dates of Selena Gomez's public announcements on lupus, like a cardiogram. And it's a nice example, really, of the public interest in a disease which can come from something like Google. Now, 1982 was a very big year, and I presented the Heberden Round. Now, this was the British Society of Rheumatology annual meeting, and it was named after Heberden. And one person, this year it was me, had to give the oration. And these were all patients in those days who came to the meeting, and they were all lupuses, but 3 of them had antiphospholipid syndrome, and I presented this for the first time in '82. But just some examples. The girl in the wheelchair has shrinking lungs, lung shrinking in lupus, and her sister, the small girl at the back, is ITP, idiopathic thrombocytopenic purpura. For the nephrologist, there's a very interesting one. The third girl from the right looks Cushingoid because she developed heavy proteinuria and then clearly renal inflammation and so on. What did the tests show? They showed renal vein thrombosis and no evidence of inflammatory disease. And she was originally put locally on steroids and is now off all treatments except anticoagulants. So this was for us the first public presentation of the antiphospholipid syndrome. And the following year, and Ricard showed these slides. This is 3 papers, BMJ and The Lancet, are all in publications in 1983. The Lancet on the right was published tomorrow, 26th of November, so it's a happy memories for us. But the complex one was in a very small journal called Clinical and Experimental Dermatology. So these came, we called it the Cardiolipin Syndrome, or the anti-cardiolipin, because that was what we used. Why did we use cardiolipin? Because my technician told me we had a bottle of cardiolipin antigen in the shelf. Is this of any use, Graham? Well, no, we'll keep it. That's the one we used of the phospholipids, not phosphatidylethanolamine and so on. And the news of this syndrome came out, started to get public around it. Migraines, cold hands, you may have sticky blood. And the media certainly have called it the sticky blood syndrome, which is not exactly right, but I think is something people understand. 2 years later, we changed the name because of all the other phospholipids to the Antiphospholipid Syndrome, published a review in J. Rheumatol. And the syndrome is represented in a small booklet which we give to patients. Doctor, do you have patients with migraine and headache, DVT, recurrent miscarriage, memory loss, or transient ischemic attacks? Well, these are features of sticky blood, or APS, or SAF, the antiphospholipid syndrome. And at that year, we had a move, fantastic move for me, to St. Thomas's Hospital. And this is another picture which follows that from Rickard. Showed a foggy day in London town, but it's very nice because some of you will recognize some of the people in this picture. Sandy Hampson on the left, the secretary who runs everything in the lupus unit, and so on. And some of the people involved in this are shown here. This is a product of Barcelona. This is Muntha Kamashta, who came from a junior person working in HIV to become a world authority, I think, on antiphospholipid, and has recently joined that very important company, GSK. This is Aziz Gharavi, a wonderful, wonderful man who emigrated under with political cloud from Iran, came to work in London, and became in a year or so the best technician we've ever had. He used to really have what we call green fingers, and did the work and was great. He also brewed the beer in the lab, so it used to smell of beer and hops the whole time. These are some of the international people, not very selective, but on the top left, Nigel Harris, who had a great career. He became the ambassador to one of the Caribbean islands. This is Muntha. On the right, a young man, hasn't changed much. And at the bottom, Angela Tincani. She was one of my smartest fellows. She's from Brescia in Italy. And I never forget giving a talk like this. And she jumped up from the front seat and said, Dr. Hughes, no, 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 no. And 5 Italian no's. And I obviously said something wrong. But she's risen to be a world authority on the problems of infants born to mothers with antiphospholipid syndrome. So very briefly, I want to come to an end by listing some of the things that we now know. And the purpose of this talk, in my view, is to link one subject, rheumatology, with many other subjects. We should not be isolated. We should be general. And we live with many specialists. These are some of the diseases that we published associations with: stroke, aortic arch, fetal loss, low platelets, ITP, bowel infarction, multi-infarct dementia, chorea, disseminated thrombosis, lividoreticularis, cutaneous gangrene, myocardial infarction, Addison's, Liebman-Sachs, and Budd-Chiari. And I'm sure there are many of you who've been involved in other related diseases related to either arterial narrowing or to thrombosis. This disease became so famous that one of your Barcelona colleagues, Dr. Miguel Villardel, and I quote him, there are 2 major new diseases of the late 20th century, AIDS and APS. And I like to believe that, especially when we're trying to get grants from public companies or politicians. This is Lady Di. She visited the unit, spent the whole day with us, visited every single bed. This is the brain that worries us, of course, but maybe the number one worry in lupus, the transient ischemic or a stroke. And this was my opening slide, that we've all thought that out there in the strokes clinic, there's a subgroup of patients who could have been prevented. And the British government have spent a lot of money in the last 2 years on stroke prevention and recognition. And sadly, I'm ashamed to say, nothing on antiphospholipid yet. So we're pushing hard to spread the word about this. And this paper just is another paper looking at a large number of ischemic strokes, again, the 1 in 5 number of patients that you see with it. And in this case, a stronger association with an IgA anti-beta 2. This is another feature of the antiphospholipid syndrome. This is a myelopathy, as you can see. And you've all seen, I'm quite sure, some patients referred to you with a label of multiple sclerosis. I don't know how common this is, but for us it presents a huge clinical problem. We find it very difficult to distinguish classic MS from APS associated. Libido, very common, very important. You see it in lupus, you see it occasionally in vasculitis, of course. But we think this, if you have this with antiphospholipid, there's a much additional risk of developing severe disease. Teenage migraine, one of the things I think is more common than you will admit. And this is another of my first two slides. This comes from America, a trial of antithrombotic therapy in patients with refractory migraine. Looked at 75 patients and gave the figures in this patient for the number of dramatic improvements in using anticoagulant of some sort. Now the net is spreading. The latest one in the last 5 years or more has been POTS. And I don't know what it's called here, but it's when you faint. It's an autonomic neuropathy. And as well as peripheral neuropathies, APS or APL affects the autonomic nervous system with fainting, teenage fainting, very common. I fainted in assembly in school 5 times. You know, this sort of history associated. And some of our patients, anecdotally, when they are anticoagulated, have been helped by this. And finally, the commonest complaint in APS, I believe, is brain fog. Brain fog is difficulty in finding words and names. Patients are concerned that they might have Alzheimer's. If for any reason they're anticoagulated, they know the difference. This slide I've shown before because I had a patient who was the darts village in her champion in her village, and suddenly she couldn't remember the 20s and the 50s. And this, for me, is the most important slide in the whole short talk. Word finding. We had a clinical association with fellows from the psychiatric department measuring memory by fancy tests of questioning and so on. And this is a young girl with APL positive, couldn't find words. Her chart was down at the 30th percentile. 3 weeks, low molecular weight heparin, self-administered, and now nearly 90% word finding. An amazing difference. And the professor of psychiatry in our hospital said he's got no drugs, no psychiatric drugs that come anywhere near this. Pregnancy, of course, has been the big selling point. It's the biggest thing that we see, perhaps, in numbers. I suffered 16 miscarriages, etc. And that's been safe. And I think you run also a lupus pregnancy clinic, or mainly antiphospholipid patients. Back in 1985, 15% of women with APL positivity, 15% had a successful pregnancy, whereas now most clinics doing this are now in the 95% range. So it has been a phenomenon in the world of obstetrics. And once a year we have a party at St. Thomas's for mothers and babies, and it's great fun, but it's all jelly babies and vomiting and things, and it's a very big PR publicity day. So to summarize, this syndrome touches on every disease, I think: psychiatry, obstetrics, neurology, transplant surgery. It's pivotal, it's important. Gastroenterology, hypertension, renal artery stenosis, orthopedics, cardiology, and so on. And for the GP or general practitioner, I'd like to put out this message. Just remember the figure 1 in 5. And these are all from published papers. 1 in 5 cases of deep vein thrombosis. 1 in 5 cases of young stroke. I think it's under 45. I may be wrong on that. Interesting, something that we didn't really feel was teenage epilepsy, 1 in 5. Some very nice papers from 2 groups in Italy and Yugoslavia on stroke, epilepsy. And recurrent miscarriages, 1 in 5. Now, I say you do the maths on that, because sitting in these large migraine clinics or large hypertension clinics, there are patients there who could be made better if you did the test and thought about this diagnosis. So I want to end with just a word about the collaboration that we have had here with the group in Barcelona. Many years ago, I think it was the first 10 Topics meeting, we produced together this composite picture of Barcelona and London. And what we did was, for 10 Topics in London, which is only 2 days, by getting money for it, we had the people, the campus, would come here and give the same meeting. And this became a huge success. I think you had 500 attendees on one occasion. And from that, we've had many, many collaborative fellows coming through. And these have included, of course, Ricard. We've produced papers together. We've had collaboration. We've done international research together. We've had 170, to my knowledge, research fellows come through our unit from Barcelona. We've done textbooks again. This is a textbook which combines Munther Camashta and Josep Font. And another paper on the right, a book from Camashta. And as you've mentioned, for me, this wonderful present of Dr. Honoris Causa, 2004, it really is something I'm so proud of. So I want to end with travel and friends. We all in this academic world do this, and we've made friends internationally. This is Yehuda Schoenfeld, who's a friend of both of us over many years from Israel, and this shows the typical food you get at an international conference sitting at a table. This one is Japan, and it's famous for me because this was a dinner where you sit on the floor. Now, it's a terrible story, but we had to go to this very, very expensive place for a speaker's dinner, and we had to take our shoes off at the door. And my wife won't like me telling you this, but I had a hole in one of my socks. And I spent the next 3 hours in agony, curling my toes up to hide the hole, and low back pain from sitting on the floor. If you can get out of doing that, then do it. We've been to many sunny places, and this was some of the teams. This is David de Cruz on the right, Yehuda Schoenfeld, Ricard, and me on the far left, and Portuguese doctor. And sunshine was a feature, I think, of my memory coming from London of some of these places, including Barcelona. So last year, I didn't get an international travel, so we had our holiday at home, and this is me with my grandson in a bus shelter resting from the rain on the bank holiday. So there are downsides to travel as well. 40 years on, the Lupus Journal is 40 years old, and I'm very proud of it. It's been really a clinico-pathological journal which has a series called Lupus Around the World. The collaboration that's really hit us in a lovely way, according to the papers you've seen already from Ricard, is the 10 Topics, held every year. And you say the 24th 10 Topics coming up. And this I produced really because the international meetings were just too big for me. I hated them. You felt rather lonely wandering around the ACR big tents. And this was 2 days only, VIP speakers, short topics, clinical and basic alternative, so you stayed awake. And this was really popular and still is, I think. And this, by coincidence, I hadn't realized it, I made this slide. This was the first Barcelona APL meeting here in this campus. And we had, the visitor you have is the lady in the middle, is Sheila Sherlock, who is the liver doctor, one of the internationally most famous doctors in Britain with her husband. And on the right, the man who made it possible in those days with sponsorship. Superb meeting, and it really made it a permanent fixture for us. So many friends, certainly from Barcelona, but other places in Spain, but Barcelona is where we have this strong feeling. And today, I'm so honored to be invited to take part in it, to give the memory, like others, of Joseph Font, who is loved by all of us, and to Richard and all involved in the new professorship, wishing you every success. Thank you.
Well, thank you very much, Professor Hughes, for this wonderful first oration, first autoimmunity oration. And just to finish this event, last but not least, I want to announce that we are very proud to say that from this edition on, this autoimmunity oration will be named Graham Hughes Autoimmunity Oration to honor your help, your collaboration, your relations with our institution. So thank you very much again, Professor Hughes. Thank you. And that's all, folks. Thank you very much for coming, and enjoy the rest of the day. Thank you.